All right, well, welcome everyone. Thank you so much for making the time today to join us to learn more about oral health. I am Denise O'Connell, the Associate Director for the Leonard-Deneen Health Education Alliance of Maine, a program of Massachusetts General Hospital in Boston. And with me today are my colleagues Tara Wilson and Samantha Knock. In 2011, Leonard-Deneen began providing education on critical public health problems where we knew education gaps existed. There's no cost to Maine participants. The organization and the programs were made possible through the vision and generosity of both Mass General and the Lunder Family Foundation. Our charge has been to improve health by providing continuing education and support to healthcare professionals. The funders had strong ties to Maine, hence the Maine focus. And this has really been a unique initiative, connecting a major academic medical center in one state with a nearby rural neighboring state. So for the first 10 years, we primarily developed programs for healthcare professionals, but also created some complementary materials and learning opportunities for patients and consumers. And most recently, we've developed a totally consumer-focused program titled Motivate at Home. And today's session is a component of that program entitled Ask the Dental Expert. We piloted this program at the end of last year and it was well received, so we decided to continue the program. Next. On this slide, if you could just please read the recording disclosure. It is being recorded. This is an education program and it will be shared broadly. It will last for 30 minutes. And because we're recording, we ask that you mute yourself and turn off your cameras. We encourage questions, so please raise your hand or enter a question in the chat box. And don't sign off till you see the survey in the chat at the end. We really want your feedback. Your feedback will help shape future iterations of this program, and by completing the survey, you will receive a $5 gift card. So thank you for that. We also want you to read this disclosure quickly just to reinforce that this is an educational program and not intended to render medical advice. All right, so let's begin. If you're comfortable, please enter in the chat what state you are in. And if you're comfortable, please also add whether or not you are a care partner or a caregiver. So what state you're in, and if you are a caregiver or a care partner. A lot of folks from Maine. Hello to our friends at the Cedars. We have some folks watching as a small group there, some residents. We are so excited about that. Hi, Bonnie, dental hygienist. Hawaii, our friends from Hawaii are here. Oh my goodness, you guys are the best. The reason we ask is that we really promoted this broadly and we want it to be a community of folks interested in this topic. And then second, we really want to stress about how many people actually are caregivers and care partners. And when we presented this recently at a conference, it was basically everybody in the room either had been a caregiver or was currently. So thank you for being here. Today is the first of a series of presentations for this newer program. This new program teaches the importance of oral health, but also what the role can be of a caregiver or a care partner for promoting oral health for their older adult loved one living at home, even if they don't provide hands-on care. It was funded in part from the CareQuest Institute for Oral Health, and the program was modified from a long-standing program that we developed for nursing home professionals, and that is now published in the Journal of Public Health Dentistry. The program is web-based, but our pre-program needs assessment of care partners all across the state of Maine revealed that while a website was convenient for them to learn on their own time that they would like some face-to-face live time with experts. And that's how we came up with this series. So the next 2-minute video will explain the program in greater detail, and it's actually been recorded by a caregiver.
Hi, I'm Carol Higgins Taylor. I help and provide support for my mother, who's in her 90s, even though she still lives independently. It's called being a care partner. If you're a care partner like I am, you might be interested in participating in a new program, Motivate at Home, which is very helpful. I love that the program was developed by health experts and organizations right here in Maine, so they know Mainers. The program is designed to teach people how to provide oral care for a loved one. Even if you don't personally provide this direct care, you'll learn how to promote oral health care for your loved one and others who may be in their situation. Caregiving and care partnering can be difficult. Like me, if you have conflicting feelings about your loved one's oral health or lack thereof, what I've learned is that it's never too late to address oral health. It's better to start somewhere and do something than do nothing at all. This program helps get you started. The initial Motivate program was developed for health professionals who care for nursing home residents. The videos and posters from that program were modified for people like us who are care partners. They created a survey, held focus groups, and spoke to care partners across the state when developing the Motivate at Home program. The best part is that the Motivate at Home program is free. This website is very easy to use and has all the education someone needs to complete the program. There are no other books or materials required. The website has brief videos, posters, audio recordings, and other resources. The videos can be viewed at any time at your own pace, and the posters dispel common oral health myths. You'll learn tips for providing oral care for someone who has dementia or is otherwise resistant to care.
I'm going to turn it over to Tara Wilson now.
Thank you. Thanks, Denise. I just love that video. Every time I see it, I just think that's so great. So I have the pleasure of introducing our guest speaker. We are thrilled to have with us today Pamela Ames, such an experienced independent practicing dental hygienist and dental health innovator practicing here in Maine. Pam is a member of the Maine Dental Hygiene Association, and it's through our work with them we were introduced to Pam. Remarkably, Pam began dentistry at the age of 16 as a dental assistant. She went on to graduate from a dental hygiene program and became the state's 23rd independent practicing dental hygienist. She also became one of the first guided biofilm therapy trainers in the US in 2020. Pam lives here in Maine, where she's the owner of Searsmont Oral Wellness Center and is passionate about teaching and inspiring other dental hygienists. Today, Pam will provide an overview of dental hygienists versus independent practicing dental hygienists. And then we'll open it up to your questions. Again, as Denise mentioned, if you do have questions, please enter them in the chat or raise your hand to speak. We also have we'll also be able to answer some questions that others have had on this topic as well that we can share with you. And then if we have any time left, we would be excited to show you the Motivate at Home website and its features. After that, we'll wrap up today's session by asking for your feedback, and I'll enter a link to the survey in the chat and ask you to complete that because it's very important information for us. So I will now turn it over to Pam to begin her presentation.
Hello, everyone. Good afternoon, and thank you for taking time out of your day for having me and joining today. As mentioned, my name is Pamela Ames, and I have been involved in dentistry for 39 years. Dating myself, but it wasn't until the last 4 that I realized how much of a role dental hygienists play in patients' overall health. Research has now confirmed that there are over 50 common diseases associated with poor oral health. Things like diabetes, heart disease, and Alzheimer's all have direct links to bacteria that should only be found in the mouth. So as caregivers, we can greatly improve our clients, families, and our own health and well-being by seeing dental hygienists and independent dental hygienists. So one of the things that we're talking about today is what the difference is between an independent hygienist and a dental hygienist that you would see in private practice um, uh, at your dentist's office. And both independent practicing dental hygienists and dental hygienists all have to be equally trained in a 3-year accredited associate degree program at minimum. And that focuses on identification and management of dental diseases. And I like to think of both independent and dental hygienists as prevention specialists. We focus on identifying the severity of the disease affecting the gums and surrounding structures and the risk factors that can affect both oral and overall health. Then we'll remove the bacteria and its byproducts, restoring health and preventing further damage. So in this regard, dental hygienists and independent dental hygienists are the same. We both have the same amount of schooling, and we're here to be your partner in care. You may be familiar with the terms gingivitis and periodontitis, but may not know what each term means. We can think of gingivitis as a completely reversible problem with good oral care habits. We can reverse the occasional bleeding gums. No damage has occurred to the surrounding bone, and the teeth are tucked securely into the jaw. But with periodontitis, which will occur with lack of good care, permanent jawbone loss can occur, and it leaves the tooth itself more exposed and susceptible to loss. Part of our job is measuring pocket depths, where you see your gum on your tooth and where it actually attaches to the bone, forms a little pocket. Normal, healthy teeth have pockets that are no more than 3 millimeters deep. You and me, everyday home care, leaving can go ahead and clean up to 3 millimeters effectively with good brushing and flossing. But anything more than 3 millimeters cannot be reached with everyday home care. And that leaves the bacteria to lay at the bottom of these pockets where they multiply and cause inflammation, which can lead to infection, deeper pocketing, and eventual bone loss, causing a cycle. So in this regards, dental hygienists and independent dental hygienists are the same. The only difference really is that independent dental hygienists are just that. We're independent from the dentist. After completing 2,000 hours, roughly a year's time working directly under a dentist, usually in a private practice setting, a dental hygienist can then apply for an IPDH license here in the state of Maine. And the only other state that I'm aware of is in Colorado. And we can own and operate our own practices without a dentist on site, often resulting in more personalized services and with less out-of-pocket expense. And the things that an independent dental hygienist can provide are things like dental cleanings, periodontal therapies. That's when you have those deeper pockets and we have to go in and clean those areas out thoroughly. We do oral cancer screenings. We do fluoride treatments on children and some adults. We do sealants, which is just a type of plastic covering that goes over those grooves of your back teeth so that you can protect them from cavities. We can do radiographs or x-rays, and recently we've now been able to provide whitening services along with good oral hygiene instruction, both for the patient and for caregivers. So any hygiene services you can receive at a private practice, you can now receive at an IPDH practice. The only difference is that we cannot do local anesthesia or a nitrous oxide, which I am both licensed to do, but we do need to have direct supervision of a dentist to be able to go ahead and provide those services. Does that help? Is there anything, any questions that anyone would like to ask at this time?
We have a couple on the slides. I think it's the two slides ahead. If you want to advance, next one right there. That's a good question.
Oh, yeah, it is a great question. And this is where this can get tricky sometimes. It's as anyone who's had to deal with dental insurance knows, that insurance companies will sometimes play by their own rules. They have different services that they will provide. And to the best of my knowledge, most of the independent practicing dental hygiene hygienists do accept MaineCare at this time. And then I know personally, I'm happy to take your insurance information, as I think a lot of independent hygienist practices are doing. And then we can send out the claims to the insurance company for patients' direct reimbursement. MaineCare does cover for us. And Northeast Delta Dental has been really, really great to work with. And there's a great team over there that has recognized the importance of independent dental hygienists and what we bring to the table as far as prevention is concerned. So Northeast Delta Dental is another one that I personally take. All other insurances, I'm happy to bill the insurance company for my patient's direct reimbursement.
Thanks, Pam. And for those of you in Maine, we worked with the Maine Dental Hygiene Association to create the list that Tara just dropped into the chat, which is a list of all of the independent practice providers in Maine, including those that accept MaineCare. So that is in there, and it also will be on their website and our website.
Yeah, and important to note is on that flyer, there's little asterisks next to each practice that does take MaineCare in a form of Medicare. And now Maine has actually opened up services to adults, dental services to adults also.
I'm curious for this group here, although so many of you are dental experts, some of you are not. And I'm curious if you could put in the chat, was this new to you that there was such an independently licensed hygienist, or had you heard about it? Has anybody ever been to one? So maybe it is not new, or folks are, there we go. Erica had not heard about it. Awesome. Thanks, Erica. Celeste had heard about it. Yes, Catherine says that they have dental hygienists coming to the Cedars. That's music to our ears. And that's, ultimately these sessions, or we're just hoping people can learn more and then get creative on how we can get what people need. Good information to know, currently learning about it. Oh, great, Tara. Thank you. She's going to email it to everyone, so you'll have that flyer.
And Linda, I think you are in Hawaii. I think I noticed earlier, and what a great state to introduce independent dental hygiene to. I know access to care is a hard one in Hawaii. So I visited Hawaii a couple years ago, and that was kind of in the back of my brain. Like, wouldn't it be great to have independent practicing dental hygienists on the various islands for for prevention reasons? I think it would be great. I'd love to come chat with you guys sometimes.
That's a great idea, Pam. And so I'm wondering, Linda, do you have this licensure level in Hawaii yet and just don't have them? It's not happening yet. Okay.
No, it's not happening yet, I don't believe.
Yeah, so you could maybe talk, Pam, how it came to be in Maine and what were the efforts leading up to the success of this getting passed.
It definitely was a huge labor of love by the Maine Dental Hygiene Association, Hygienist Association. Those ladies fought tooth and nail. I mean, it came to be, I believe it was in 2008 or 9 is when independent hygienists came to Maine in a sense. And I believe that we modeled on Colorado. And the biggest thing was, access to care. There wasn't, our state didn't have, we have a lot of rural areas where people just couldn't get to dental offices. Number one, that was taking their insurance, mainly MaineCare, but also because these patients actually were, they had a hard time getting to the bigger cities. So that's where it came about. And I always thought to myself, like, Hawaii would be a great place for that with the islands. So
That's great. And so in Maine, it wasn't until 2022 that we got an adult benefit, comprehensive adult benefit for Medicaid. And so to have folks like you, Pam, accept it, that's really creating wonderful access for others. Other questions? If not, what we'll do is we'll turn it back to Tara, who will talk to you a little bit about next steps and other sessions, and we'll give you the survey, but we do welcome any questions that you may have for Pam or for us.
The only question I see perhaps is on, if you go down a couple slides on 12, what would be a reason I would need to see a dentist instead of an independent practicing dental hygienist? Like, is there ever a time where, Pam, you would, as a dental hygienist, have to refer out to a dentist?
yes. So we, as dental hygienists, we prevent soft tissue diseases, meaning the gums and the surrounding areas of the tooth. Whereas a dentist, they will fix hard tissue diseases, things like broken teeth, cavities, extractions, nerve damage. So we, like I had mentioned earlier, we're prevention specialists. We fix the gums and get the patient out of infection, away from inflammation, whereas the dentist would fix cavities, teeth that need to be extracted. Maybe they need to make a patient a denture, or maybe they need to do an implant. So we're prevention. We don't alter the tooth structure in any way, whereas a dentist can do that.
That's awesome. Thank you. And so any other questions for Pam? Okay. So what I will do is I'm going to put the evaluation in the chat box so that you can see that, and ask that you complete that for your feedback. It's certainly not a lengthy one. That would be wonderful. So I'm going All right, so I've put information in the chat box for the survey for you to please complete, if you would take just a few minutes for that. And I know people were having a little bit of trouble with the PDF opening it, so I will be emailing that out to the whole group as well. So thank you, Pam, for being with us today. We really appreciate it, and just such great information, and really important information to share. So we just couldn't be happier to be able to have you with us today.
Oh, and I loved it. Thank you. And if anyone has any questions or further wants to find out any more information about independent dental hygiene, and feel free to reach out. I don't know if you guys have left my email, but yeah, I can put it in the chat box if anyone wanted to message me directly.
That would be great. Thank you, Pam.
Yeah.
And if you notice on your slide right now, you'll see our upcoming sessions. We do have 3 more sessions scheduled throughout the end of the year. So we're hoping that we'll see all of you back here again. If you have any friends, family, coworkers, anyone that you believe would be interested in participating in this, please have them visit our website at oralhealthwisdom.com.